Safety Talk 4, Confined Space Program. As previously noted, the scope of this training may be limited for office personnel. However, understanding the rules is mandatory for all staff. During plant walkthroughs or joint health and safety committee inspections, you may encounter this type of work. Being informed enables you to identify and report any unsafe practices, allowing issues to be addressed proactively before they lead to an incident. Let's watch a general video on the confined spaces.
A confined space is generally an area that has inadequate ventilation. The space can be enclosed or partially enclosed and is not intended for continuous human occupancy. Access, egress, and workspace are often restrictive and poorly lit, preventing a fast escape if there was an emergency. A confined space is sometimes determined by the hazards associated with a specific situation, not just because work is in a small area. Some examples of confined spaces include sewers and pits, crawl spaces and attics, boilers and storage tanks, ventilation shafts and access tunnels, telecommunications vaults and elevator shafts. Asphyxiation and death can occur when entering a confined space with an inadequate level of oxygen. This process happens when other gases, such as chemical vapors or smoke, displace the oxygen in a confined space. These gases could result from a leaking natural gas pipe or chemical processes, such as welding fumes or generator exhaust. In the case of trenches, pipes, and tanks, the hazard may be from the release or movement of large volumes of water, soil, or other materials. The evaluation of asphyxiants must be determined by the risk assessment process. Ensure all mitigation controls and risk assessments are properly documented. Before entering a confined space, an authorized person must use a suitable gas detector to determine the oxygen level. As low oxygen levels are the most common cause of death in confined spaces, accurate oxygen level measurements are essential. Hence, an appropriate calibrated and well-maintained oxygen meter is critical. The oxygen level of the air is 21%. Never enter a confined space if the oxygen level is below 19.5%, or due to the increased fire hazard when oxygen exceeds 23%. Never enter a confined space to rescue someone unconscious unless wearing a breathing apparatus. In such a situation, contact your local emergency services. They have the suitable equipment to attempt a rescue. The atmosphere must be tested if any confined space contains flammable, explosive, or toxic substances. This monitoring must be carried out by a trained and competent person using a suitable and correctly calibrated gas detector. Flammable vapor must be less than 5% of the lower explosion limit. Hydrogen sulfide must not exceed 20 parts per million. Carbon dioxide must remain below 30 parts per million. Ensure all measurements are probably documented. Only workers with the relevant qualifications will be permitted to enter a confined space. Personnel must complete and sign the required confined space permit before entering any confined space. Ensure all the appropriate PPE is evaluated and used. Personal air monitors must always be worn. Ensure harnesses have a current test certificate. All personnel entering a confined space from above must be connected to the rescue winch. Anyone entering a confined space must have a spotter. The standby person must monitor the well-being of those inside the confined space. If a serious incident occurs, the standby person will immediately contact your local emergency services. If you have any concerns or questions, ask your supervisor.
TC Aurora's confined space. The only identified confined space, the chiller tank, is located in the chiller room, which is locked, and Tim Van Slingerland has access to it. Chiller tank is used to store the chilled water. This tank is in the chiller room near receiving area. Chiller tank has two openings, one at the top and one on the side bottom. 24-inch bowl manway is 24-inch in diameter and hinged access manway is 20 inches by 24 inches. This space has never been entered in the past, as no work was required on this unit. Only authorized contractors are permitted to perform work in confined spaces. According to TC's Confined Space program, internal workers are prohibited from entering confined spaces. Only authorized contractors are permitted to perform work in confined spaces. Currently, Tim Vanslingerland, maintenance manager, is the designated person trained in the Confined Space program and will be responsible for issuing permits for confined space work. All maintenance employees who are authorized by Tim Vanslingerland to enter the chiller room for other tasks must comply with the above rules and must never engage in work within the confined space. If you need more information regarding our programs, contact your supervisor or health and safety manager. Stay safe, and thanks for your continued support to make TC a safe and healthy place to work.